Hello everyone, I'm Tom Parkin and welcome to Colorado Health Matters, where we educate and inform you about treatment options now available in the ever-changing world of medicine. We have teamed up with Colorado's best physicians and healthcare facilities to explore the fascinating world of today's healthcare. So, stay with us because there's nothing more important than your health. Gastroenterology is the medical field that studies and treats the digestive system, also known as the gastrointestinal tract. Hepatology is a medical specialty that focuses on the study, diagnosis, prevention, and management of disorders affecting the liver, gallbladder, pancreas, and biliary tree. The University of Colorado's Division of Gastroenterology and Hepatology in the Department of Medicine, located at the Anschutz Medical Campus, is an internationally renowned program that provides comprehensive resources for the diagnosis and therapy of diseases of the digestive tract, pancreas, and liver.
About 50,000 patients are diagnosed with gastric or esophageal cancer in the U.S. each year. These cancers require complex, multidisciplinary treatment. So patients receive usually a combination of surgery, systemic therapy, and radiation.
The Division of Surgical Oncology provides innovative treatment of cancers through the latest surgical technologies. We are a high-volume referral center for esophageal and gastric cancer. These diseases require delicate surgery and a highly specialized team to achieve the best result. Our expertise spans from cutting-edge minimally invasive robotic surgery to complex surgical technique to remove locally advanced aggressive cancers.
I'm delighted and honored to speak to you on behalf of the GI Division, the Cancer Center, and our recently established Radiesophageal and Gastric Center of Excellence. The Radi Center was established with one primary aim: to change the epidemiology of esophageal and gastric cancer and improve outcomes in our patients with precancerous and cancerous disorders of the esophagus and stomach, and in patients with complex foregut disorders.
Here at the CU Cancer Center, our mission is to discover, develop, and deliver breakthroughs in the diagnosis, treatment, and prevention that improve cancer care. This is the cornerstone to translate basic science knowledge of gastric and esophageal cancers into clinically useful treatments for patients.
We are dedicated as a team to providing personalized care for each patient that we see. So we meet together as a team of multidisciplinary providers and we create a plan, and then we review that plan with the patient, allowing them to meet multiple doctors on the same day to discuss this complex treatment plan.
Our research pillar within the Radi Center focuses on a multidisciplinary approach that includes a team of interventional endoscopists who perform cutting-edge procedures using state-of-the-art techniques that also focus on organ preservation. We have motility experts, surgeons, oncologists, radiation oncologists, and expert pathologists managing our patients. In addition, we have a robust research program that is funded by federal grants through the National Cancer Institute, NIDDK, Department of Defense, GI societies, our industry partners, among others. This program focuses on basic, translational, and clinical research knowledge gaps in our field.
Our goal is not only to remove the cancer, but also to enhance recovery and return to normal life. Our surgical oncology faculty are members of the University of Colorado School of Medicine. They are nationally recognized leaders serving in leadership roles in national and international medical societies, including many as leaders of international guidelines for tumor treatments.
Our goal is to provide patients diagnosed with all stages of gastric and esophageal cancers the most modern treatment options, including chemotherapy, immunotherapy, and targeted treatments. The field of esophageal cancer has experienced multiple breakthroughs in the past 10 years, in which we have uncovered cancer biomarkers that can be targeted with new systemic treatments.
At the University of Colorado's Division of Gastroenterology and Hepatology in the Department of Medicine, You will find experts in general gastroenterology, passionate physicians and advocates for patients with inflammatory bowel disease, highly skilled interventional endoscopists, and dedicated professionals specializing in general and transplant hepatology. Radon is a radioactive gas that has no smell, color, or taste. Radon is produced from the natural radioactive decay of uranium, which is found in all rocks and soils. Radon escapes from the ground into the air, where it decays and produces further radioactive particles. It can cause lung cancer after years of exposure. We spoke with Dr. Aiko Browning from Rocky Mountain Cancer Centers and Dr. Daniel Gross to learn about this health-threatening gas.
Dr. Gross and I are active participants in St. Anthony's Multidisciplinary Lung Nodule Conference. This is a team where representatives from multiple disciplines, including medical oncology, radiation oncology, thoracic surgery, pulmonology, radiology, pathology, and our nurse navigator meet weekly to review the images for people who have been found to have a lung nodule. A lung nodule is a spot on the lungs that shouldn't be there. It can be hazy in appearance, what the radiologists call ground glass, or more solid in appearance. Lung nodules can be caused by many different things, including infection, such as pneumonia or a viral infection, inflammation, or potentially a cancer. Not every nodule ends up being cancerous. At our Multidisciplinary Lung Nodule Conference, we review our patients' CT and PET images together and come up with a plan as how to best follow their nodule, or if it is more suspicious, how to best get a biopsy to find out what it is.
Dr. Browning and I are also active participants in St. Anthony's Multidisciplinary Tumor Board Conference, where we get together as a team to make recommendations as to the best evidence-based treatment for someone who has been diagnosed with a lung cancer.
We would like to take this chance to raise awareness in the community regarding reducing your risk of developing lung cancer. The leading identified cause of lung cancer is tobacco use. If you are a smoker, the best thing you can do for your health is to quit smoking. The second leading identified cause of lung cancer is radon exposure. Radon is a naturally occurring, invisible, odorless gas that comes from radioactive breakdown of uranium in the rock and soil. Radon can enter your home through cracks and gaps in the foundation. In the state of Colorado, radon is a significant public health concern. When homes in Colorado are first tested for radon levels, 47% are found to have unsafe levels of radon. After breathing in radon at unsafe levels for years, the DNA in your cells in your lungs can take on damage to the point where you can develop lung cancer. This is a risk both for people who don't smoke as well as people who do smoke who are at higher risk. In order to help reduce the risk of developing lung cancer related to radon, you need to first test your home for radon. The Colorado Department of Public Health and Environment has low-cost and free radon test kits available to the public. Visit their site at coloradoradon.info.
Dr. Daniel Gross tells us about the treatment of lung cancer as a result of radon exposure.
The treatment landscape for lung cancer has evolved significantly over the years with several new, promising approaches. For early and locally advanced non-small cell lung cancer, surgery remains the cornerstone of treatment to remove the tumor and identify local spread. Recent advances have allowed us to perform more targeted surgeries, leading to equivalent outcomes while preserving lung function with faster recoveries. Chemotherapy, often used for locally advanced and metastatic stage lung cancer, either alone or in combination with new therapies like immunotherapy or targeted therapy, has led to dramatic improvements in patient outcomes, with durable tumor responses and very prolonged survival. Radiation therapy uses high-energy rays to target cancer cells when surgery is not an option.
Rocky Mountain Cancer Centers has been a leader in providing world-class cancer care for over 30 years. As the largest multidisciplinary practice in Colorado dedicated to oncology and hematology, RMCC offers cutting-edge treatments with a personalized, compassionate approach. RMCC is part of the U.S. Oncology Network, which includes over 1,400 independent physicians nationwide, advancing innovative, evidence-based cancer care. At Ingredients for Life, the unique combination of compassionate, expert concierge primary and preventive healthcare help clients achieve their health goals. During extended visits, Dr. Christina Anton Schnell focuses on bringing back what matters in life, health and happiness. She takes the extra time to share the science of how to stay healthy and prevent chronic conditions such as heart disease, diabetes, and cancer. She likes to explain why food matters and what macro and micronutrients do to the body. She also discusses how stress, sleep, and satisfaction affect the same pathways as food and medicine. Utilizing up-to-date, peer-reviewed medical and nutritional research, she elucidates how healthy lifestyle choices improve energy, weight, blood pressure, glucose levels, sleep, and overall life satisfaction.
Hi, I am a concierge or membership-based primary care internal medicine doctor. I limit the number of patients in my practice so I can give each member the attention they deserve. I offer same-day and next-day extended appointments with no wait times. I spend a lot of the appointment time listening to patient concerns and the other part educating on how the body works and what makes it last longer and stronger. I am one of the few medical doctors who understand both medicine and nutrition. I also understand how stress impacts health and also guide clients into a more relaxed state of mind. I am proud of the way I practice medicine. I believe in knowing not just the biology and disease processes of a person, but also what is going on in their life, job, relationships, and future. My patients know and feel that I truly care.
Dr. Anton Schnell tells us about the services they provide at Ingredients for Life.
I am passionate about helping prevent heart disease and creating a healthy, fulfilling life for my patients. That's why the concierge membership plan makes primary care as flexible and in-depth as possible, offering these benefits and more to all of my members. Same-day and next-day appointments, tailored 1 to 2 hour consultations, executive physicals, medication prescriptions, preventive health solutions, expert nutrition guidance, advanced cancer screening, advanced cardiovascular screening, and telehealth options are available. I offer comprehensive primary care services addressing your immediate health needs. I believe in diagnosing and treating heart disease before there are symptoms. Through advanced blood and imaging testing, I am able to prevent heart disease before it becomes severe. With telehealth medicine, all of the beneficial healthcare solutions are made easily available over telephone and video calls. For gut and brain health, I discuss the microbiome and how important the gut-brain connection is. I review which foods nourish the microbiome and which foods to avoid. I deeply believe in food as medicine. I also implement a comprehensive approach to well-being, addressing body, mind, and spirit.
Dr. Anton Schnell has been my doctor for several years. I have always felt confident in her level of care, her professionalism, her knowledge. I would 100% recommend Dr. Anton Schnell for your entire family.
Dr. Christina Anton Schnell at Ingredients for Life will help you get your health and wellness back to where you can live your life to its fullest. Hearing loss is the third most common chronic health condition in the United States. In fact, it's more common than diabetes and cancer. Hearing loss is most commonly caused by aging, genetics, loud sound exposure, and certain chronic health conditions like heart disease, kidney disease, or diabetes. One of these causes is completely preventable, and that is loud sound exposure. We spoke with Dr. Melissa Fling at Custom Ear Solutions to learn how she can help you prevent hearing loss due to loud sound exposure.
As an audiologist, I specialize in hearing health, and part of maintaining healthy hearing is protecting your hearing from damage that loud sound exposure can cause. Loud sound-induced hearing loss in many cases is completely preventable. Loud sound exposure is also the leading cause of tinnitus, which is intermittent or constant noises in the ears and/or head like ringing, buzzing, or humming. Tinnitus is very common in individuals who are regularly exposed to loud sound without good hearing protection. Loud sound-induced tinnitus and hearing loss are not only very common in adults, but they are becoming more common in our children due to the use of earbuds and earphones for listening to music and playing video games. In addition, hearing loss in adults that goes untreated for many years is potentially related to a decline in cognitive functions such as memory and processing speed. Tinnitus has been associated with anxiety, depression, sleep disturbance, inability to concentrate, and other mental health problems. So hearing loss and tinnitus are not standalone problems. They can have a much greater effect on your overall health than you might expect, and it all starts with prevention if possible. It's my mission to help individuals learn how to protect their hearing and prevent hearing loss and tinnitus due to loud sound exposure. I created Custom Ear Solutions for this exact reason, to educate individuals about hearing conservation and to provide custom-fitted hearing protection products to those who are at risk for loud sound-induced hearing loss. I love custom-fitted options, and they can be a great alternative to other styles of hearing protection that may not work well for certain individuals, depending on the size and shape of their ear canals and depending on how they're using hearing protection. I also provide miscellaneous custom-fitted earpieces for communication, Bluetooth earbuds, water activities, sleep, and much more. I can offer my services in office or on-site, which provides flexibility to businesses, schools, and other organizations that may benefit from a provider coming to them.
Let's learn about the services Dr. Fling provides at Custom Ear Solutions.
I offer a number of services and product solutions to help you monitor and protect your ears and hearing. On-site services include otoscopic examination, earwax removal, hearing screenings, diagnostic hearing evaluations, consultations for custom-fitted hearing protection and earpieces, ear impressions, and product delivery, fitting, and fit testing.
What caused me to reach out to Melissa initially was I got my concealed carry license, and I happened to be practicing out at a gun range, and I just happened to see, I saw a business card. And so it was just easy peasy. It just rolled on up and came in and gave me a little appointment and did a serious test. A couple days later, I get some things that were made for me, and I came back in and fitted them in, and I've been off to the races ever since.
Custom Ear Solutions is a different kind of hearing healthcare business, one which focuses on education and prevention. With their flexible way of providing services in office or on site, Custom Ear Solutions strives to meet your specific needs. If you've been thinking about custom-fitted hearing protection or earpieces for yourself or a friend or family member, text or call 720-839-7705 or email contact@customearsolutions.com today to learn more. Living with missing teeth can be both physically and mentally stressful. It can keep you from eating foods you enjoy and leave you feeling self-conscious about your smile. Plus, if left untreated, having missing teeth can negatively impact the health and stability of the remaining teeth. Fortunately, dental implants can be a long-term solution to fill in gaps and improve oral health and function. We spoke with Dr. Ryan Hambleton at Highlands Ranch Oral and Facial Surgery to learn more.
When you have missing teeth, several issues can arise. It can lead to jawbone loss at the side of the gap. The remaining teeth can become misaligned, drift into the gap, or loosen. Missing teeth may alter facial features. Missing teeth can cause chronic headaches, inability to talk properly, inadequate nutrition, and sinus expansion. Dental implants are replacement teeth that are affixed directly into the jaw, similar to the root of a natural tooth. Once the titanium implant or screw is placed, the jaw begins to fuse around it, holding it securely in place. This bonding, also known as osseointegration, is what gives dental implant stability and strength. After the implant is placed, a small post or abutment is attached to the top. This is what sticks out of the gum and holds the crown or replacement tooth. Crowns are molded to your mouth so they fit perfectly and blend in with the remaining teeth.
I feel great. I like them. I think they look really natural. And my family says they look natural, and they were listening. They really, really listened to me, what I got to say.
Restore the beauty, comfort, and functionality of your smile through exceptional care and the latest procedures in tooth replacement and oral surgery. From Highlands Ranch and the surrounding areas, patients receive personalized service aligned with their needs and goals for better oral health. At Highlands Ranch Oral and Facial Surgery, you can correct missing teeth and structural issues with confidence. Medicare is our country's health insurance program for people aged 65 or older. Signing up can be complicated by confusing enrollment periods and decisions about which coverage works best for you. Missing deadlines, delaying enrollment, or choosing the wrong plan can cost you. 2025 will see major changes to Medicare. So, to help you with this process, talking to an independent Medicare broker can save you time, money, and your sanity. Sejal Patel is such a broker and tells us about navigating this complicated process.
So I think it's really important to talk about Medicare in general before you're 65. And the reason why is Medicare is so complicated, not only just about enrolling, but even post-enrolling in Part A, B, and D. There's also lots of different letters, Part C, Part F, Part N, and Medicare Advantage, and what is Medicare Gap. So answering all those questions before you actually apply to register for Medicare, I think is important so that you have some clarity. So as a Medicare broker, we sit down with clients and we try to find out what their current healthcare needs are, their financial needs, and try to match them with an insurance plan that works for them, whether it's a Medicare Advantage plan or a Medicare Supplement plan, so that way they're maximizing the benefits that they receive.
2025 will see a lot of changes to Medicare. Let's learn more.
The biggest change in 2025 with Medicare is related to the prescription drug part, which is Part D. The max out-of-pocket for 2024 was $8,000, and in 2025, it's going to go down to $2,000, which is an amazing benefit for the client. But there are implications for that change, and that's why it's important to talk to an independent Medicare broker so you can find out how those changes will impact you. In an annual plan review, we talk to clients about their healthcare needs from 2024 and their prescription needs and see if their current plan actually fits their needs for 2025. If they do, we keep them on that plan. If they don't, we change them to a new plan where they can maximize their benefits. So why I chose to become actually a Medicare broker was I wanted to go in to work in an environment where I was helping people. And I feel like with Medicare being so complicated, it's a time for me to work with people and help educate them and help make sure that they are really understanding and not being taken advantage of in a process that can be so complicated. And really that's why I chose to do this line of work. You know, I was a psychologist in my previous life of working with children, and after 18 years I decided to do a career change, and I felt like I could make that connection with people, you know, and seniors are like I said, a population that is very vulnerable to being taken advantage of, and that's kind of why I chose this.
If you are turning 65 soon, please contact Sejal Patel to review your Medicare options and benefits. Sejal Patel is here to help you navigate the Medicare process. Prepare yourself for 2025 by setting up a consultation. Scan the QR code, call 303-517-0074, or email sejalpatel5280@gmail.com. The mission of the Silver Tsunami Aging Info is to provide valuable resources, education, and a supportive community for caregivers and families navigating the challenges of dementia care. We spoke with founder Kathy Miracle to learn about this amazing company.
Dementia is the second most feared diagnosis in the world. And when families hear that diagnosis, whether it's from their primary doctor or from a neurologist, it can create panic and it can create fear. No one growing up ever said, hey, I want to be a family caregiver to someone with dementia. It is a very difficult journey. It becomes an emotional, mental, and physically draining experience. Families get slingshotted into this role without any education, training, or knowledge. And they live day to day and sometimes hour to hour doing the very best they can. And caregivers simply get burnout. And so we're trying to fix that for them by giving them more solid education through Silver Tsunami. So communication is an important piece of when you're caring for somebody with dementia. And what most family caregivers don't understand is that communication needs to change at every part of the journey. So in the beginning part, communication can still be normal and they can carry on conversations most of the time like they did before. However, as you start to travel through the dementia journey, communication needs to be simplified. choices need to be simplified. So during the middle stages of dementia, I usually tell families to use, 2 options. Talk slower and lower your voice. The person is going to be able to better understand what you're trying to communicate. As you get into the later stages of dementia, pictures work great, or even words. And I encourage families to laminate those things because they'll use them over and over. But again, continue to simplify things as much as possible and slow down your rate of speech because they simply can't process the information like they used to. Behaviors are an expression of communication, and the word behavior has actually been negatively linked to people with dementia and toddlers. If we get up and walk across the room, that's a behavior. If we go out and drive our car, it's a behavior. I really encourage both professionals and families to term this an emotional expression because that's exactly what they're having, and they're trying to use this to communicate. Cognitive health is actually the last frontier. It is something that scientists and doctors have been studying for several years in order to understand how to keep somebody cognitively strong. Changes in the brain can now be identified up to 20 years prior to a dementia diagnosis. Dementia can now be avoided, dementia can be delayed, and in some circumstances, cognitive decline can actually be reversed. Brain training and cognitive exercising are becoming more popular, and there are different companies and programs out there that offer both. Dementia-friendly environments can absolutely be created, whether those are in the home or in a professional environment. But what we're really trying to do is help families better understand how to create that dementia environment at their home so that it becomes easier to travel the dementia journey with their loved one. So simple things like changing the lighting in the home so that there's less of a fall risk. Removing throw rugs, because those can also be a fall risk. Simple things like closing the drapes at night so the person does not see their reflection in the window and think that somebody is trying to break in. Not having appliances on all day. And so there's different furniture and modifications that can be made to be able to support safety and improve independence with the person who is traveling the dementia journey.
Whether you're a caregiver, a family member, or someone interested in learning more about dementia, the Silver Tsunami Aging Info is the right place for you. They create a supportive space where you can share experiences, ask questions, and learn together.
We know at Silver Tsunami, as do a lot of families, that traveling through the holidays can be really difficult, frustrating, and overwhelming. Silver Tsunami will be holding an event on Thursday, December 5th at 6:30 at Colbell Library in Arapahoe County. Pre-registration is required because some seating is limited. So please visit our website to register for the event, and I hope to see you there.
Well, that's our show for today, and I hope you found the information helpful. If you'd like to see any of the segments from the program again, please go to our website at coloradohealthmatters.com. For everyone on the program, I'm Tom Parkin. Thank you so much for watching, and please join us next time for another edition of Colorado Health Matters.